A very good morning to you, Betty. It's good talking to you after a long while. Yes, the nurses in Nyeri County are just about to begin a procession to the governor's office where they want to seek his audience. They want to air their grievances, and they have assembled here at the Nyeri Health Center. I think you're able to see a group of them, meaning that the public facilities in this county, operations have been paralyzed. Yes, the doctors are in hospitals as well as the clinical officers, but the nurses are not there, and they say that they are the backbone of service delivery in hospitals, meaning that if they're not there, then operations cannot continue. There'll be no normalcy in issuing services to the patients. Like we were able to see a few patients coming here to the health center, but they were turned away because, practically there are no services if the nurses are not there. And part of the grievances that they want addressed include lack of promotions, Betty. And they're also decrying a shortage of nurses, saying that about 400 of them have left and they have not been replaced either through retirement or death or any other reason, but they have not been replaced, and therefore the few that are there are actually strained. And Betty, just to maybe paint the picture clearly, is that the main theatre, the Nyeri County Referral Hospital, has not been operational for about a month now due to this very shortage of nurses that they are talking about. Perhaps to give us a further insight into the matter, we are just about to talk to Githiong'o, who is the chairperson of the Nyeri County Branch Nurses Union, and also nationally she's the organizing secretary, to just delve into the matters affecting the nurses here and why they are going on strike, or why they have begun this particular strike. Thank you very much, Madam Anne Githiong'o. Could you tell us why the nurses in this county, what are your grievances?
Okay, good morning. Our grievances, we as nurses of Nyeri County, is lack of promotions and shortage, and also at the same time our working conditions are not also good. Now why we are here is that we want to express our grievances because we want to visit the offices, and we tell them we as a team, as a Nyeri County nurses team, that we are going to continue with our strike until we get what is rightfully ours. Because as you know, since the year 2013, there is nothing on the welfare of the staff that has been done. So that is why we are here, and we are ready to continue with the strike until we are heard and our grievances are dealt with.
Madam Chairperson, perhaps have you tried seeking a legal redress earlier on? Because remember, there's a time also nurses in this county had gone on strike, and you tried seeking solutions to the problems. It's the very same problems you're talking about now. How far did that go?
Now, that one we went through the Labour office, and we had an agreement which was not met. So we still feel that the county government of Nyeri is ignoring us, because they could not even order the return to work formula we had the last time we were